Okay, so we're going to finish up here with the G's, and I'll give you a break after the G's. Decrease G. We're still talking about supplements here, you all. Everybody wants to take the G's. Garlic versus garlic supplements. Forget the supplements. I don't know of anybody that takes garlic supplements. Why would you? The only person that takes them is Larry King Live. That old goat, he's still on, you all. On Larry King something else now. But he talked about how fabulous garlic was to protect his heart. He had 7 heart attacks. Is he really a good person to 7 wives, 7 heart attacks? So this guy, I mean, he was talking about garlic. Garlic is good for you, but not really as a supplement. Take it in food. Mix your pasta with a little garlic every day or whatever you eat garlic in. Ginkgo, not beneficial for dementia. Hasn't been shown to help mild cognitive impairment or prevent dementia. Be nice if it did. We'd all be popping it. It does, however, interestingly, improve blood flow to the feet. So, American Heart Association actually came out with a study in December 2010 that showed ginkgo is very beneficial for peripheral arterial disease. So, that would be something you could recommend to your patients, but also realize that ginkgo is a potent platelet inhibitor. So if they're also on aspirin and clopidogrel and other new ones out, Brilinta, there's Xarelto, there's a million new anticoagulants and antiplatelet drugs out there today. You got to recognize if you also add ginkgo to it, you might have some more problems with platelet inhibition. Okay, there's something out there called grapeseed extract, potent antioxidant. No doubt about it, that's a good word, antioxidant. However, why would you buy that when you can eat grapes? Grapes are beautifully antioxidants. They're fabulous. So if you want to buy a $45 bottle of grapeseed extract, go ahead. But it's a waste of money as far as I'm concerned, if you like grapes. Okay? And then we have ginseng. This one is the one that kills me. And if you're taking it and you feel better on it, then keep taking it. But the point is, on the side of the bottle, there's always a big red flag when it says, this is good for anything that ails you. From a bunion to a brain tumor. It's going to cure you. Well, not really. It's been around for over 5,000 years, though, so obviously it does something for people. But ginseng has a zillion side effects that I really think people should know about. One is platelet inhibition. So if you're on ginseng and ginkgo and garlic and grapeseed extract, there's not a platelet that'll work. Number 2, ginseng is a potent sodium and water retainer. So what will that do for your blood pressure? Up it goes. And number 3, in men, ginseng is estrogenic. Causing what? Big boobs. In women, it's estrogenic. Your boobs won't grow, but you can, if you're a woman with a uterus, have dysfunctional uterine bleeding. It will, if you're still having periods, it will prolong your period by another day. That's annoying. So I just want to tell you that even though if you like the ginseng and how you feel, some people say, Barb, it gives me energy, I feel great when I'm on it, then great. But understand that your blood pressure needs to be checked. If your periods are prolonged, it's the ginseng, no other reason. If you're over 55 and you've stopped having periods and you start bleeding again, the possibility that it's ginseng is important. But don't forget this too, you all. Dysfunctional uterine bleeding in older women, postmenopausal women, 75% of the time it is cancer of the uterus. So don't just say, oh, she's on ginseng. Use a tampon. Check it out. Okay. Glucosamine. Now this one, of course, has been shown in 50% of the studies, glucosamine shows that it works for your joints, for osteoarthritis. In 50% of the studies, it shows it doesn't. So if I talk to 50 orthopedic surgeons, what would 50? If I talk to 100, what would 50 say? Take it. If I talk to the other 50, what would they say? Worthless. Do what you want. Some people swear by it. I say give it a whirl. But here's the point with all alternative medicines. You must take them for at least 3 months before you get any, generally before you get any kind of relief. Now in the United States, that just doesn't work. Barb, I've been on glucosamine for 2 days. Hasn't done anything for me. And I bought a bottle with 1,000. Well, keep at it, because in 3 months you might feel a heck of a lot better. Give it 3 months. Alrighty then, and then of course green tea. Does anybody drink green tea in here? Yeah, it's certainly very healthy for you. Let me just say that. But most people don't like the taste, unless you've been sort of weaned on green tea. It's a pretty bitter type of tea, you all. But if you like it, I say take it. It's got many, many health benefits. But it also interacts with certain drugs, and one of the drugs it interacts with is simvastatin. Potentially harmful. What do I mean by that? Potentially harmful means that green tea can make simvastatin doses so high, meaning make that dose not lower but higher, that it can cause the muscle aches and pains and even rhabdomyolysis. So no green tea if you're on simvastatin. Okay, so on that note, now there are a lot, California, they all drink green tea. Those states that do those things, like Washington State and California. Again, there's truly, I don't like the taste of it. I wish I did, because of the health benefits, lots of benefits of tea, and green tea in particular. Yeah, actually it can cause Lipitor to go up a tad, but not like Simva. Simvastatin really gets a kick from green tea. And unfortunately, simvastatin is what? The one that everybody uses, because it's $4 copay or $9 copay or cheap copay. And so a lot of the drug companies want you to use this one. Now, again, I just read a study this morning from the new journal, the Circulation Journal, saying that simvastatin is a very safe drug, you all. It is safe. It and pravastatin tend to have the least side effect profiles. However, simvastatin with grapefruit juice and green tea can be toxic. Simva in particular. That means the next G is grapefruit juice. You say, well, how toxic, Barb? Well, grapefruit juice and or green tea can increase the bioavailability of simvastatin by 700%. Wow. So, what have they taught you in clinics and in the hospital about grapefruit juice? Don't use it. What do you tell your patients? Don't drink it. Grapefruit juice, you all, can interact with 60, 70% of all drugs. So let me tell you why, and then I promise to give you a break. When grapefruit juice or grapefruit juice inhibits an enzyme in the small intestine called CYP3A4. So let me go back for a second. Again, one nice thing about being a nurse for 400 years is you do see a lot of different things. And up until the 1990s, we thought that all drugs were basically broken down the liver. Remember learning that? The liver enzyme systems broke down the drugs. Every once in a while you get a drug broken down the kidney, and every once in a while you get a drug broken down the lungs. But the liver did the lion's share of the work. Okay, in the mid-1990s, that all changed. It was a slap in the face. Pharmacologists from Canada found that we actually start breaking down most drugs, somewhere around 60% of the drugs, in the small intestine. So in the small intestine, you have one of the biggest enzyme systems that you also have in the liver. And the one enzyme that is located in the small intestine that does the bulk of the work is called CYP3A4. CYP is cytochrome P. Who cares? So when you start taking drugs and you swallow them to go in through your stomach and down into the small intestine, the actual first hit in the small intestine starts to decrease the bioavailability of those drugs. Okay. Grapefruit juice inhibits this enzyme. So if you stop the enzyme from working, you absorb the drug in a higher bioavailability, meaning it becomes more toxic. So grapefruit and grapefruit juice increase the toxicity of close to 60% of all drugs. Now sometimes that doesn't matter, but other drugs, it can kill you. So it's easier to say what? No to grapefruit juice and yes to drugs. So that's why we've taken them out of nursing homes, all grapefruit juice. We've taken them out of hospitals. Even though grapefruit is great for us, if you're not on any drugs, you should be eating grapefruit all the time. But if you're on drugs, you might as well just say, that's it. Well, Barbie, if I can't have grapefruit juice, can I eat grapefruit? No. Same stuff. Well, if I take my pill at 8 in the morning, can I have grapefruit at noon? No. It's a 72-hour reaction. So that's it. And that's why Florida is the most toxic state in the world for drugs. So, my dad did it. My dad's going to Florida for 3 months. They used to do it, not anymore. They're in their 90s now. But they used to drive down to Florida for the winter, like all the little Q-tips, little white heads driving down to Florida. Yeah. Call them Q-tips in Florida. It's hysterical. Anyway, so down they went, and my dad was on simvastatin. And I said to him, Dad, do not drink grapefruit or eat grapefruit juice or eat grapefruit while you're down in Florida. Okay. I said, you're on simvastatin. This can cause you to get lots of muscle aches and pains and could really potentially be very harmful. Okay, no problem. Got in the car, drove down, stopped at the Georgia-Florida border, bought a 900-pound grapefruit, started sucking on it, and within a week, he called me and said, oh, man, my legs are killing me. I can hardly get out of bed and walk. My jaw went out. Dad, are you eating or drinking grapefruit? Well, yeah, it's Florida. Why not? I'm like, oh, my God, I told you a week ago. Don't. He said, oh, that's right. That's what you told me about grapefruit. So I called his doctor down there. They all have their own doctors down there. So I called his doctor and I said, listen, my dad refuses to not eat grapefruit juice down here. So would you please switch him to Crestor? Rosuvastatin does not interact with grapefruit juice. So there are some that don't, you all, and that's when it gets to be really tricky. Which ones do, which ones don't. But if they're going to be down in Florida, we're going to go back to the statins a little later on, so I'll tell you this again. But suffice it to say, if you got somebody that just can't give up grapefruit, and they're only on a statin, then switch them to either Pravastatin or Crestor, Pravachol or Crestor, because those do not interact with grapefruit juice. They're broken down by a different enzyme. Okay. So, the toxicity with amiodarone, if your patients cannot understand this toxicity, honestly, if your patients do not get it, you don't think they will understand it, and they're on amiodarone, take them off amiodarone. This can kill them. This interaction is deadly. Grapefruit juice and amiodarone, cortisone. It's already a toxic drug, you all. It's already nasty. It's good, but the side effects profile is really pretty nasty. So that can kill you. Felodipine, all your dipines, which we'll get to later, calcium channel blockers, interact with grapefruit juice. So we can see that these particular drugs, the grapefruit juice toxicity is headaches, severe headaches, swollen feet, pedal edema, huge swollen feet, because these are side effects of these drugs anyway, but if the grapefruit juice is taken, it increases the side effects. All right, Zocor, 700% increase in bioavailability of simvastatin. Wow. Erythromycin, why do we even use that drug anyway in adults, you all? That's just got so many side effects. I don't get it. In children, yes, because they're not on any other drugs. But in adults, erythromycin is just nasty. But if you throw in grapefruit juice, you might as well just put them in the grave, yeah. Torsades de Point, boom, thump, dead. Right on the mall. Okay, so enough on that. We're going to stop here, take a break, and we'll come back and talk about some OTCs, and then we'll hit the drugs. Anyway, so we have, of course, over-the-counter drugs that people take. There's a zillion of those, y'all. 10,000 over-the-counter drugs. Isn't that amazing? That can wreak havoc. Not all of them, but you just have to also think about a lot of the things that happen with over-the-counter drugs. So we've got cimetidine, which is Tagamet. There's nothing wrong with Tagamet if that's the only drug you're taking. If you have Tagamet, however, and you're old, what do we define as old these days? Well, when I was in nursing school, I remember saying to my best friend, "Oh my God, I got to take care of that old man in room so-and-so. He is so old, he's 42. Oh, he was ancient. I mean, my God, you're 18. 42 was like, ah. So, and of course, people that were at 65, in my days in nursing school, that was old. 65 was old. They were all sick. They were all dying. Of course, today that's not true. I mean, you do see some obviously 65 years old, but we're now really talking about 75 and older as the geriatric patient. But you've seen some 75-year-olds that can run circles around you. So there's really, that age is what we're defining as old, 75-ish. Okay, so with the elderly, one dose of Tagamet can actually cause delirium. It is so potently anticholinergic. So it's just a lousy drug in older people. Anticholinergic anything is lousy in older people because of the side effects of constipation and blurred vision and tachycardia and urinary retention and all those things that are anticholinergic. Well, Tagamet is another one. It's nasty in the elderly. It also has multiple drug interactions. So truly, if an older person says, "I got a little heartburn, what should I take?" Send them straight to the Pepcid aisle. Pepcid, famotidine, is safe, it's effective, it doesn't have very many drug interactions. So if they need an H2 blocker, go with the famotidine, which is Pepcid. All right, how about Tylenol? Why do we still have this drug over the counter? I'm serious. I mean, if you think about all the people who are on liver transplant lists because of Tylenol, all sorts of things that go on with Tylenol. We whip things off the market that nobody had any side effects from, or one or two people. We're talking about hundreds, if not thousands, of people with Tylenol toxicity. But it still is over the counter. The overdoses sometimes are inadvertent because they don't realize they're taking all this Tylenol in every product in the world, or acetaminophen. The therapeutic dose is almost the same dose as its toxic dose. So when you're up there therapeutically, one more pill and you're over the edge. So it's not just acetaminophen in 300 over-the-counter products. It's also in all sorts of opioid products, as you know. It's a potently synergistic drug, you all. When you add it to an opioid, it makes the opioid work better. So hence why we have everything with the last name Set. Fioricet, Percocet, Loricet, Propicet, Roxacet, Altacet. We used to have Darvocet, but that's a worthless drug. So we have the government has asked kindly all of the drug companies that add acetaminophen to an opioid, would you please just add 325 milligrams per pill? Because we have Vicodin extra strength that's 750 milligrams of Tylenol per pill. If you take 5 of those, plus you've got a headache and take Tylenol for that, plus you've got sinus problems, so you take Sinutab, all of a sudden you are taking so much Tylenol that your eyeballs are yellow. So the government has asked the companies nicely if they will do that, so we at least have an idea of how much Tylenol you've taken with your pain medication. Alrighty then, so Tylenol's in every itchy, sneezy, wheezy, snotty, achy, breaky product. Vicodin for pain, Excedrin for headache, Theraflu for cold or flu, Sinutab for allergies, Robitussin for cough, Allerest for sleep, and believe it or not, some people take all of those in one day. 10 grams to 15 grams of acetaminophen can kill your liver, especially if you are also drinking adult beverages. Even 2 a day to 3 a day. With all this, can kill the liver. So now McNeil, who makes the brand name Tylenol, has actually said in their bulletin, to reduce the risk of Tylenol toxicity, no more than 3,000 a day. Wow. So we are really trying to cut back on how much Tylenol people use. How good is it for pain management by itself? Not very good, you all. Now some people say, oh, one Tylenol really helps me. Fine, if it helps you. But most of the time people say, I take it and nothing. It's not helping my inflammation because it's not anti-inflammatory. Slap, slap, slap for the people who give it for inflammation. It works in the brain. It doesn't have anything to do in tissues like aspirin. Aspirin works peripherally and centrally. Tylenol only works centrally in the hypothalamus. Aspirin and nonsteroidals work in the hypothalamus and in your inflamed tissues to reduce prostaglandins. Tylenol does not. As a temperature-lowering mechanism, it's also slow. And I can't remember where I read this article, but I remember the numbers. I've got to find that article so I can give you the source. Aspirin lowers your temperature in 35 minutes. Ibuprofen lowers your temperature in 44 minutes. Tylenol takes 77 minutes. So if you want a temperature lowered fast, where are you going to go with? Aspirin. But we don't use it much anymore, you all. I know that, but I'm just telling you. We used to use it all the time for temperature. Yeah?
I'm new to Coumadin, so I can't take aspirin or anti-inflammatory, so Tylenol's really...
Yeah. Or morphine. Nothing wrong with that for a little pain. Well, that's the problem. We are woefully inadequate in the world of pain management. I know we say we're getting better at it, but not really. I mean, you really, especially for the aches and pains of the elderly. So, yeah, I mean, can you take a non-steroidal? Yes, you can. Not daily for weeks and weeks on time, but with Coumadin, it's a totally different mechanism of action. We don't want you to do it every day, but we certainly have people on Coumadin and low-dose aspirin for hearts. So if you absolutely had to have something for an acute inflammatory response, you can take ibuprofen. You really can. It's not going to kill you at all. One's a platelet inhibitor, one's a factor inhibitor. So we don't like to combine them on a day-to-day basis. But if you need something for a couple of days, there's no problem with taking ibuprofen. And we prefer you take a leave anyway, just because of its cardiac effects are less. Okay, so on that happy note, what's in a name? When you hear bear, what do you think? Literally, you ask anybody at any mall, bear, aspirin, bear, naked, bear. I mean, but when you do ask this, and they've done a beautiful job branding bear as aspirin. However, Bear aspirin is aspirin, but Bear Select Maximum Strength Headache is Tylenol. So people will grab it off the counter thinking it's what? Aspirin. But it's Tylenol. Well, I didn't take Tylenol. I took Bear. But did you read the box? Well, no. Who reads the box? Nobody. All right. Bear Select Pain Relief is ibuprofen. So Bear's done a beautiful job with their branding of aspirin, but they also need to put a big, huge bloop that says this is not aspirin. Okay. Aspirin's principal use today is in low doses as a platelet inhibitor. We rarely use it for temperature, of course never in children with any kind of flu symptoms because of the Reye's syndrome. Adults do get Reye's syndrome, so we do mention that we don't use it for adults with flu-like symptoms either. So it's just really not used a lot. Now, I would like to make an exception to that rule, especially in pediatrics. Children who have a disease called Kawasaki disease, we certainly use aspirin in them because we are preventing the cardiac aneurysms that they get with aspirin. We also can use, I don't mean cardiac aneurysms, coronary artery aneurysms. With children with juvenile rheumatoid arthritis, we tend to use aspirin as well. So there are selected conditions where aspirin is a primary choice. But years ago, aspirin was everywhere for everything. Okay then, so don't panic. Know the 30 or 40 drugs you use daily in your clinical practice, depending on who you are, what you do. If you're pediatrics, it's asthma and antibiotics, basically. If you are in women's health, it's birth control pills and hormone replacement therapy. I mean, there are more drugs, obviously, but those are big ones that you're using all the time. If you're in geriatrics, I'm sorry. It's everything. The lists go on and on and on. So know what you use best, and don't ever be afraid to look it up in front of a patient. I have the best internal medicine doctor in the world, and he has a wonderful nurse practitioner. And every time he prescribes something, I don't care who it is, and I don't care what drug it is, he looks it up to make sure that the dose hasn't changed and that it's what he prescribes. And there's nothing wrong with that. Years ago, you thought people didn't know what they were doing. They looked it up. How can you not today? There's too much going on.